As you read when you chose today's presentation, we are going to talk about the pelvic floor. I'm sure a few of you at home are probably thinking, Marie, what's a pelvic floor? Let me reassure you, you're not the only ones who do not know. So we'll take the time and the energy needed to discuss this and prepare you properly for your delivery. Sometimes mothers ask me, what can I do before childbirth to help the delivery and the recovery? This is when you need to prepare your pelvic floor. To better understand this, I've invited a pelvic floor specialist. Her name is Marie-Ève, and she's a trained physiotherapist. She teaches at university and has completed specialized training in France to learn more about the pelvic floor. She is really a great resource, and I'm happy to have her here today. So I would like to present Marie-Ève. I'm happy you could join us today.
Thank you. Hello, Marie.
For the benefit of moms here at home, I wanted to ask you to explain what the anatomy of the pelvic floor is, what it represents in the whole system, and what its role is during pregnancy and delivery. Then, if you have a few specific little exercises that we can show them at home that they can use in order to prepare their pelvic floor.
I'd be happy to. Concerning the muscle structure of the pelvic floor, which makes up the pelvis, it's important to understand that it's a muscle structure that attaches to the pelvis and the abdominal wall. In a standing position, there are bones that form the hips and the pelvis. And looking more closely at the muscle structure of the pelvic floor, there are muscles attached to the pubic bone that form a sling which attaches to the coccyx. There are several layers of muscle intermixed with fascia and other tissues that solidify the structures. And if we look inside the pelvis, we can see organs that are attached to the pelvis and abdomen. In a standing position, the pelvic floor is shaped like a bowl, and it supports the organs inside the pelvis.
Perfect. So that really clarifies it in terms of the anatomy. But what role is the pelvic floor expected to perform during pregnancy?